So you mentioned complications, Rob, and I'd love to hear let's say it's a more involved mass, maybe some encasement of the aorta, the renal hyla, some of those trickier masses that are at the left periaortic, perihilar region. What does that look like?
Yeah, so I break it down into categories, and then the extent that you go into categories depends on the extent of the mass. I always start with common things, so bleeding, chance of infection. The two I spend the most time on is ascites and loss of ejaculation, and again, that depends on how involved the mass is, if it's bilateral or unilateral. And then I get into a category I call injury to other organs, and that's where, as you alluded to, if it's up by the kidney, up by the renal vessels, I talk about possible risk of ureter, renal vessels, need for nephrectomy. I talk about injury to bowel, injury to other major vascular structures, so that's all in that category. But the biggest chunk is that ascites, loss of ejaculation, and injury to adjacent organs. That's the three biggest categories we spend most of our time discussing.